Hey there, this is KP with Coronavirus Diaries, a channel dedicated to the documentation of a world under lockdown. And today Minnesota has lifted its lockdown for the most part. I'm going to be monitoring that closely and reporting on it after we've been open for a little while. After all, these things take time, especially with COVID-19's incubation period. Which leads me to this video subject. Today I'm going to talk about some confusion in the media. I've done several videos relating to this kind of thing, but this time it's not the media's fault. They reported what was given to them by the WHO? Yes, the World Health Organization. A few days ago, you may have seen something buzzing around social media that states that asymptomatic transmission of COVID-19 is very rare and that people who do not show symptoms are highly unlikely to spread the disease, going in direct opposition to what we've been told from the CDC and many other medical scientists, which led to the majority of lockdowns and stay-at-home orders. This looked promising, a spark of hope that maybe we can move forward and not be as worried about getting it from someone who does not show symptoms or giving it to someone who is high risk without ourselves showing any symptoms. After seeing this story, the next day I read this bit about asymptomatic versus pre-symptomatic, and it piqued my curiosity. I mean, the definitions of these terms are pretty obvious. One is where a person shows no symptoms at all throughout the entirety of having the disease, and one just isn't showing them yet. When you're talking about a disease with a 2 to 14 day incubation period, it's pretty hard to tell them apart in the real world. Soon after, I saw a few stories about Dr. Fauci and several other medical professionals stating that what the World Health Organization reported is flat out wrong and misleading. People who contract this disease and have absolutely no symptoms at all for its entirety are very rare. What's much more common is that they have very mild symptoms and they happen to be the ones who spread it more than any other. This makes sense. People with serious symptoms aren't going to just brush it off as allergies or a sinus infection and be out and about spreading it to others. In the end, the World Health Organization backtracked and reissued the report with more clarity, showing what we've pretty much been told all along. We already knew that asymptomatic people are not the main driver of this disease. People with serious symptoms are going to be quarantined or hospitalized for the most part, so that leaves the middle ground, where people have very mild symptoms or are pre-symptomatic and spread it unknowingly. This part I find a little strange. Many in the public health community expressed disbelief that the World Health Organization would disregard asymptomatic patients, especially since the threat of asymptomatic spread has shaped many government lockdown policies. I realize that what the World Health Organization did was irresponsible and unclear reporting, but if what they had found was true and they had been more clear about it, then it shouldn't matter what government policies were put in place with what we knew at the time. After all, the government policies put in place are a response to the scientific research of the disease, not the other way around. And that research is bound to change what we know of the disease over time. That being said, at this time, several studies show that up to 40 to 45% of people infected with SARS-CoV-2 will remain asymptomatic or have very mild symptoms and can spread the virus unknowingly. I hope this clarifies some things. Please subscribe for more clarification in these confusing times. Stay safe out there and God bless. This is KP, signing off.